Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Want to welcome everybody. Some news before we go to a special segment. First is that Ann & Hope has closed all of its stores throughout New England. The retailer, which was one of the biggest retailers in the Northeast in its heyday, considered the model for both Kmart and Walmart in the type of buying that it did and type of products that it sold, is now no more. Somewhere around 10 stores throughout New England have closed. Mark that one up to another retailer hit hard by the coronavirus. Let's go to a special segment. We've got Professor Paul Stekler, one of the leading documentarians, American Experience, Sundance Award, Peabody Awards, you name it, he's won them. He's at the University of Texas, and he joins us along with Dr. Michael Fine, our regular afternoon with Dr. Fine, the former Director of Health. Paul and Dr. Fine, welcome.
Thank you, Josh.
Thank you very much.
Dr. Fine, you know Paul Stekler. Obviously, Paul is in Austin, Texas. Texas is a hotbed for the coronavirus right now. Number of cases in Texas has risen to 125,000, although the number of deaths is still under 2,500, a very different type of spread of the disease and its impact in comparison to what's happened in the Northeast. Rhode Island obviously is right around 1,000 deaths, but only has 15,000 cases. Dr. Fine, let's go and explore what's going on in Texas.
So, Paul, can you talk a little bit about what your experience is just as a person, your ability to move around, and in being in a blue bubble in a red state, how people around you are reacting?
Basically, there's not bodies in the streets, but at the same time, Texas is really a mess right now. Basically, I'm not sure that we ever had a population that was doing very much in terms of wearing masks for social distancing. I mean, to a certain extent, but the state was only sort of quasi-locked down for a month, and the governor was late to doing that, took away the ability of localities to be able to make people wear masks, and sort of, gave them less leeway in terms of their actual laws, and then came out of this and started reopening the state fairly quickly. In terms of my experience, even in Austin, which is, fairly blue compared to the rest of the state, just driving around, you would see very few people wearing masks, especially young people, and almost no social distancing. And so, quite frankly, what's happened here is not much of a surprise. I think I went out of town about a month and a half ago just to get out of town driving, and in sort of medium-sized little towns outside of Austin, an hour and a half away, nobody was doing anything as if, the virus didn't exist. So this is not a surprise to have this kind of a spike in virus infections. And even though the numbers of deaths may not be skyrocketing like they were in New York City, Houston, I believe today, is saying their ICU units are 97% full, and most of the big city mayors are really scared about what this actually portends for the future, especially in that, you can begin to, tell people to wear masks. You can try to be able to legislate how large the gatherings are, but this is all dependent on people actually following this. I believe that when Vice President Pence was here, was it yesterday? He was at a church and the choir was singing without masks. It's kind of like, you get what you get what you do. And once you let the cat out of the bag, especially in a place which is not, full of people that are looking for government directives, what are you going to get? So what's my experience? My experience as an older American who's not going to swim parties with hundreds of people, like we had outside of Boston, I think a day or two ago, at something called Pong Fest. Is you wear a mask, you stay fairly safe. It's not Stalinist. It's kind of like I run every day. I don't run in a mask, but I'm not, running very close to anybody. So how does it affect my day-to-day life? It's fairly depressing because it's looking like this is going to be the way of life for a long time until we get a vaccine. I know the president thinks that's going to be next week, but I mean, Dr. Fine, you know that vaccines will show up in a year, 2 years. What was it, 7 years for the vaccine for polio? And so until that happens, I think what you're going to find is that young people who don't listen to anything anyway will continue mixing and getting the virus, and old folks are going to be stuck at home, because they're scared in terms of what's happening. So the future looks great.
But there was in the Northeast a tremendous amount of political leadership around social distancing and mask wearing. Does none of that exist in Texas at all?
No. I mean, the governor is a fairly weak governor. He's always been scared of of the lieutenant governor and the attorney general, people to the right of him. As in all statewide Republicans in this part of the country, they're all completely scared of the president, and doing anything that's out of lockstep with him. So that it's a measure of just how freaked out Governor Abbott is that he did anything. That he took a look at these numbers and all of a sudden he allowed city mayors to be able to have more power, so that now all of them are saying you have to wear masks in public, and reducing the number of people that can be in restaurants for those people that are nutty enough to want to go to a restaurant. I mean, from 75% down to 50, and closing all the bars. So now people have to drink alone, or it's Pong Fest. So that, so I think that's an indication of how scared he is. And quite frankly, he's getting denounced by people to his right to allow people to legislate that people have to wear masks. Has anybody learned anything? No. I mean, you have leadership, from, let's say, County Judge Lena Hidalgo over in Harris County in Houston. The mayor of Austin, Steve Adler's been okay. But I mean, there's only so much you can do. It's kind of like, I just don't know. It's kind of like if you're looking for leadership from the state, it's not going to happen.
How about people themselves? Folks on the right who want the right to not wear masks, are who they are. Are
Right.
they changing at all, seeing the extent of the disease around them?
That's going to be an interesting question. I think that it's really going to take deaths or hospitals completely flipping out, and then maybe something will happen. I think that, basically most politicians are not profiles in courage. Their basic impulse is to get reelected, and so that if you're a conservative Republican in a place like Texas, your tendency is to go, I've got to win my primary. I've got to get on the ballot, and if I get on the ballot, then I get reelected. Okay, now, we live in somewhat extraordinary times. I don't want to say that, oh my gosh, I woke up this morning and Joe Biden is going to win in a landslide, as long as they keep him in the basement someplace. And he doesn't say anything. But as Trump becomes more unpopular, and doing things that are politically head-scratching, this is a very weird time to be going to the Supreme Court and asking them to overturn the Affordable Care Act, especially with pre-existing conditions, or defending Confederate statues, or tweeting out people saying white power. It's not helping his popularity. And so that in the self-preservation, way that politicians look, if all of a sudden it becomes a free fall in the Trump presidency, then you may begin to have people, timidly take more of a stance. But it really depends on where this is all going. I mean, I don't know that anybody in the medical field understands what might happen in Texas. Will people begin to die? If people begin to die, and the cases get, the hospitalization cases, not the infected cases, but the hospitalization cases get so high that everybody knows somebody, then all of a sudden public opinion might change. And if public opinion changes, that leads to electoral consequences, and it leads to public officials perhaps having a change of mind. But nobody knows where this is going.
Professor, you've been involved with some major documentaries over the year, whether it's American Experience or Eye on the Prize. Is this the most interesting subject matter you've ever seen, this collision of a public health disaster coupled with divisive politics? Does this lend itself to a multi-part series looking at these complex issues and how they're ramming together as we see them right now?
Well, you're talking about mass entertainment. How does it compare to Tiger King? We live in a fairly dumb period of time in terms of what entertainment is. I've got no idea. Basically, when you do multi-part series like this, it's always great to have some sort of historical perspective as opposed to like 1 week ago, especially when we don't know where this is all going and we're living through this. I have no idea. Will there be a miracle, a Trumpian miracle, and it'll all go away when it gets hot outside, like you said it would? Where is the America's discussion of race actually going? Is it going to actually any kind of legislation? Is it going to more understanding? Is it going to nutcases taking down abolitionist statues in Madison and beating up Democratic gay representatives? You tell me. I have no idea. Essentially, it's hard to be able to figure out how to make a film out of this. And quite frankly, as somebody who really loves covering politics, how do you make a film that involves Donald Trump? The story changes every single day. And so there is no way to be able to beat the nightly news so that you can try to do something. Okay, but I think that that way lies, sort of like news coverage as opposed to actually giving it some thought. When you think about a series like Eyes on the Prize, the civil rights history, it had power because it was done years afterwards. You could actually think about it. When you think about the best historical documentaries, you want to be able to have something that says not only what happened, but what did it mean? And what it meant is generally something that you figure out in hindsight years after. And then years after that, revisionist historians change what it means.
Dr. Fine, in Texas, they have 125,000 cases, nearly 10 times as many as we've had in Rhode Island, but only 2,500 deaths in comparison, only 2.5 times. Is the disease different in Texas than in Rhode Island, or have they been more efficient in treating it from a healthcare standpoint, or is it who's been infected?
Well, my guess is it's a couple of things. First of all, it's very likely who's been infected. Remember, Rhode Island has the largest proportion of people over 85, and so the likelihood is that many of our deaths are because of our age. That's what we saw in Italy, and that's what I think we're seeing here. What we're hearing, though I haven't seen the data yet, is that many of the infections in Texas are younger people who tend to do better. That's probably the most significant reason for the difference is, the difference in age. I don't think the disease is likely to be any different. We've learned some things about how to take care of people in the hospital, and my guess is those things will benefit young people more than they benefit older people. That probably plays in as well.
Professor Stekler, you're at the University of Texas, one of the largest academic institutions in the country. Is there a game plan for the fall as to what takes place? Is it possible there's not University of Texas Longhorn football this fall?
In terms of the football team, I have no idea how you bring 100,000, 50,000, 20,000 people into a stadium. It's I just don't know. I think people are trying to figure this out right now. They're sort of dancing around going, how bad is this going to be? How many classes have to be online? I think they've already made the decision that they want people back here. I think the university goes out of business financially if we don't have most of our students here paying tuition, even though it's in-state tuition. That said, I think all the large classes will be online because they just don't want to put 400 or 1,000 people into a room, and that smaller classes, as long as you can socially distance, can be taught. If I teach my MFA graduate course with 12 incoming filmmakers, I can do that in a room, without feeling that I'm risking myself. But I think there's a lot of teachers who, feel the risk because of their age. And it's hard to force somebody into something, so they'll probably, even with smaller classes, teach online, through Zoom, which is what most people are using at the University of Texas. Well, we're trying to figure out how do you actually take out equipment to do production? How do you do film production in any kind of a safe way? Does anybody actually want to be filmed by a film crew? Given the uncertainty. So, we have meetings every week. We're trying to figure this stuff out. It's very anxiety producing and frustrating. We'll figure out something, and on August 26th, we'll start again. Do I think we'll have football? The football players want to play, including all those ones that are in quarantine right now. I would be very surprised if they play in front of any kind of large amount of audiences.
Wouldn't it take the apocalypse to stop football in Texas?
Yes, I think you're looking at it right now with sports. Even with golf, with no audiences, you have a small number but a growing number of players and caddies that are coming down positive. The NBA is putting everybody in a bubble over in Orlando for their small season. Nobody knows how the baseball thing is going to work out in terms of having no audiences and will the players be infected or not. You can't have more of a contact sport than football, and it's kind of, this is the big deal over here. We have lots of sports. The University of Texas athletic budget, I think, is probably close to $180 million. What is that, the whole budget for URI? But that's part of the identity of the state. And if all of a sudden the team couldn't play, yeah, that would be kind of like a cultural apocalypse. So I'll believe that when I see it. I just don't know how I don't know how they're going to do anything. I really don't. It's kind of like, and being in the middle of this, there's just a lot of uncertainty, and the uncertainty doesn't make you feel very good about the future.
The culture of Texas, Friday Night Lights, Texas Rangers, sort of an independent country within the United States sometimes. Is there a chance that because of the absolute health risk, folks will adopt safe standards, social distance, wear a mask at a high percentage? Or do you think Texas will just battle back and forth with this virus until there is a vaccine?
I don't know. I'm going to go out to go early vote probably as soon as I'm done over here. It'll be the first time that I've actually really been out of the house besides just, doing my 3 or 4 mile loop running. And so I'll be able to see people on the street and see if there's any difference. I think, actually, quite frankly, the other day, I did notice there were more people on the street wearing masks, including people that were running. So do I think this will change behavior? It can't get any worse. So I think it'll get, better, I guess. There's nothing like people dying that or people going to the ICU and almost dying to be able to make you think about your own life or having your parents get infected. So if we have more people that are infected and have health problems or whatever, it probably is going to impact something. But quite frankly, you tell me up in Rhode Island, are most people wearing masks? Are most people social distancing for real?
No, they are not wearing masks.
Okay, so then
they were 3 weeks ago. Then the governor got caught in a very high-profile situation at a protest not wearing her mask. That sort of seemed to beat back any momentum to getting people to wear their mask. And now, I don't want to say it's a lost cause, but it's maybe 20% adherence, at least on the public streets and going in and out of restaurants.
It's the president was over in Phoenix the other day, in a church with 3,000 young kids wearing mega hats and no masks. And unless you have proof that they're all going to die, I think many people are going to see things like that and go, well, if they're doing it and they're okay, why not me? So, I'll believe people changing their mask behavior when I see it. On the other hand, I got a pile of masks over here. You want me to display them? They're really nice.
Hey, Dr. Fine, can you give just a quick update on the Rhode Island numbers from the weekend?
Sure. We unfortunately had 19 deaths over the weekend. So we have a total of 946 deaths in the state. We only had 16 new cases, a lot less testing over the weekend. Only 73 now in the hospital, 15 in the ICU, 14 on ventilators. So we are doing, with weekend numbers, we appear to be doing amazingly well. The question is what happens over the next 4 to 6 weeks.
Yeah, and the spread from these hot spots around the country, either traveling by car or by plane, and does that recycle the infection throughout the Northeast again?
Yeah, I think that's an open question. To me, there's something we don't understand about this virus and why it shrank so much in Rhode Island, and I keep being careful that the pendulum might swing back.
Yeah, absolutely. Listen, I want to thank both of you, Professor Paul Stekler, one of the leading documentarians in the United States now at the University of Texas, and Dr. Michael Fine, former Rhode Island Director of Health. I want to thank both of you for joining us today. Stay tuned for 1 o'clock, Governor Raimondo's press briefing. And for everyone else, please, please stay safe.